So today with Dr. Gavin Macgregor Skinner, who's a director of GBAC, a division of ISSA, we're going to talk about a simple question. How important is eye protection when we think about this coronavirus?
It's a great question, Jeff. And we know from the CDC, the Center for Disease Control, recommendations for hospitals, healthcare providers, they recommend that eye protection should be worn. And there's a very good reason for that. So again, everything we do through ISSA GBAC, our program is based on risk assessments. If you're in a situation where you think that you're close to a COVID-19 patient, or the risk assessment tells you you need to protect those eyes, I think it's very important that people start wearing eye protection like I do when I go to the supermarket, when I'm on a plane, and start to protect those eyes, because it's not just the nose and the mouth, it's also the eyes that could lead to infection with the SARS-CoV-2 virus.
So how does that work? We breathe air, and we understand that droplets can go into our airway, but the eyes, how do they become a transmission source?
Well, there's so much that remains unknown about the new coronavirus, SARS-CoV-2. We're still trying to establish whether infection can actually happen through the eyes. It is biologically plausible. Now, there's a clear tissue that covers the white of the eye, and it lines the inside of the eyelid, and it's known as the conjunctiva. Now, we already know that it can be associated with other virus infections, such as adenoviruses. Now, these are the viruses that are associated with the common cold. Also, the herpes simplex virus, and that's the virus that could cause cold sores on your mouth and your lips. So we know that this conjunctiva that's on the eyelids viruses can attach to it and can cause infection.
So that could happen through the air, and I imagine on the fingertips. What do? We rub our eyes. That's
exactly, and this is really important because we know that if there are droplets from an infected individual, produced by coughing, sneezing, or even speaking, then the front of the eyes can be directly exposed. This is just like the nasal passages or the mouth that can be exposed. And so to know if SARS-CoV-2 virus could infect the eyes to the eye's surface cells, we need to know a couple of key things that allow the virus to attach and enter and then infect you. And there's some new research that's coming out this week that is going to identify those key things that could lead to infection by SARS-CoV-2 through the eyes.
So you mentioned a Johns Hopkins article on that. Is there any more details from what you read?
This is very exciting, Jeff, because we know the eyes have played a role for other virus infections. We know the key receptor for coronavirus in our bodies is what's called the ACE2 receptor. Now, in order for SARS-CoV-2 to enter a cell, the virus has to attach to these ACE2 receptors. ACE2 receptors are on surfaces like in our lungs and other organs, but we also know that they are on our eyes. And so we now know that the ACE2 receptors are on the conjunctiva in our eyes, and that because the conjunctiva has these ACE2 receptors, the SARS-CoV-2 virus could attach to it. But there's one other thing. We also know that the eye's surface cells also produce an enzyme. And again, unfortunately, these enzymes don't have really cool names. This enzyme's called TMPRSS2.
Yeah, that's not cool.
It'd be a lot easier if we just call it Jeff, because then we know the enzyme was called Jeff, but it's not. But the enzyme's called TMPRSS2, and this enzyme helps the coronavirus enter our cells. So the research that's coming out this week tells us the conjunctiva in our eyes has ACE2 receptors, but also has this enzyme, TMPRSS2, which are the two critical need components to allow the SARS-CoV-2 virus to attach and then to infect our cells so we get infected by the virus and cause COVID-19. So that's what's changed. That's why eye protection right now is so important.
Well, those watching this, especially our frontline cleaners, hopefully will protect themselves and keep this in mind. Besides wearing the face mask, eye protection as well. All part of the PPE protocol. And
there's another really important point that we need. Again, we're really challenged, Jeff, by saying what we know and don't know when it comes to SARS-CoV-2. More research is needed right now, but the evidence suggests that the surface cells of the eye can be infected. And if we understand how we get infected, the virus can attach to those receptors in the eyes. The virus could then travel through the tear ducts that connect the eyes to the nasal cavity, and then subsequently could infect the respiratory cells. Now, why this is important is that we've found SARS-CoV-2 virus in tears and eye secretions. So when we take a swab from someone's eyes, we've actually found the virus there. And so it's important now, if we're touching surfaces and we don't clean and disinfect them properly, and then we touch our eyes, we could get infected. But what's also the possibility of tears or eye secretions, or us touching our eyes, then touching the surface and infecting that surface with virus. And again, this is not a maybe or a possible, this is what we know right now. And until we know otherwise, I would really emphasize we still need to clean and disinfect appropriately, and we still need to protect, and more importantly, nose and mouth, but also importantly, protect our eyes.
Very important information, and scary as well. So, you know, someone who wears a face mask, if they get sick, they might wonder, how's that possible? I protected myself. Maybe not so much where they haven't thought about it. So,
and those discussions will be we'll have, oh, well, the glasses aren't good enough. The glasses are better than having nothing over the eyes. I wear glasses, I wear sunglasses, I wear goggles. I also have a face shield. And again, whenever I leave the house and I have to go to a supermarket or get on a plane, but more importantly, if I'm working with COVID-19 patients in the hospital and nursing homes, I do have eye protection as well as protection for my nose and my mouth. And I would really highlight this, especially as we see, you know, the country start to reopen up. Those that are working, again, now the front lines has expanded. Restaurants, hotels have all become the front lines. Start to consider and look at the risks and start to wear eye protection as well as protecting nose and mouth, and wash the hands and clean and disinfect surfaces.
yes, well said. Well, thank you for all your help.